I wanted to thank everybody for being here today. I greatly appreciate it. And I also greatly appreciate the other organizers from this workshop. They've done a tremendous job. Catherine, Alan, Shannon, greatly appreciate all of your input and suggestions as we move forward. Again, today is going to be similar to the previous days, but we're, like Alan mentioned yesterday, we're short one speaker today, so we're actually going to cut short. But each presenter has about 30 minutes to give their presentation. We're going to take a quick break and then reconvene into breakout rooms for discussion. And then come back, moderators will discuss in a larger group, and then we'll address bigger questions as we move forward. And again, special thanks to all these different institutions for their help and support with bringing this together. And I just wanted to really give a special thanks to Amy. I really appreciate your help with this. You've been amazing through this entire process. And so greatly appreciate that. And I also appreciate the support we've had with technical support of pulling this together as well. So you guys talked about the ancient mariners. So I'm going to talk, or the ancient mariner. I'm going to talk a little bit more. I'm going to talk ancient as well. And when we talk about climate and climate in the context of human health, we should realize that this isn't a new concept by any means. This is something that's been going on for quite a while. And you could go all the way back to Hippocrates, who, if you read some of his ancient notes, talked about changes in weather patterns and outbreaks of certain diseases. And then moving forward, which Hippocrates, many of you know, is many people consider like the father of modern medical thought, the Hippocratic Oath. And then as you move forward, we have James Tilton, who is a Surgeon General for the US Army. And James Tilton, in 1814, directed all hospital surgeons associated with US medical facilities to take measurements of temperature and precipitation. And the reason that Tilton instructed all hospital surgeons to take measurements of temperature and precipitation was because they understood at that time that a change in temperature and a change in precipitation was leading to soldiers becoming sick. They didn't understand the linkages there, because what they were actually seeing at the time were things like malaria and yellow fever. And they didn't understand that mosquitoes were a potential vector that was transmitting that disease. But they could understand that changes in temperature and changes in precipitation were leading to outbreaks of disease. And so obviously today we have a much better understanding of how climate is controlling our health, but we've understood for a long time that climate has a direct impact on our health in a variety of different ways. And so that's what we're going to talk a little bit about today, is how climate is a part of our health and how changes in our climate potentially have influences on our health as well. And so you know you made it in the world if you introduce yourself. So I'm Jesse Bell. I'm a professor of the Claire M. Hubbard Professor of Water, Climate, and Health at the University of Nebraska Medical Center. I've been here for about 3 years. During that time, I'm now director of the Water, Climate, and Health program, and also the broader Water, Climate, and Health initiative that's through DWFI, or the Water for Food Global Institute. And I'll talk more about some of my work and some of the things that I've been associated with. And then I'd also like to introduce Yusong Lee, who's going to give a presentation today. Yusong is the professor in the Department of Civil and Environmental Engineering at the University of Nebraska-Lincoln. And today, I'm going to start off by talking about the nexus of water, climate, and our health. As I said, one of the first things I want to talk about is this new opportunity that we have at the University of Nebraska that we're building around, that really gets at the heart of some of these geohealth related issues. And I think it's a unique and interesting opportunity that we're building off of to really see how we can better integrate and understand how changes in water and climate potentially impact our health. And so we had a very generous donation from the Claire M. Hubbard Foundation. It's a local foundation. They provided financial support for us to start this new program and new initiative across the University of Nebraska. And with this new initiative, we're building interdisciplinary collaborations across the University of Nebraska system to try to address Nebraska's public health challenges related to water and climate. And we're doing this based off of 4 different pillars, which is research, education, policy development, and training. And we're really trying to focus in on the impacts here locally in Nebraska, but also not just doing research for research sake, but making sure that we're doing capacity building within the state as a whole. And so when we're talking about water, climate, and our health, really what we're getting at here, especially in the context of the program that is developing at the University of Nebraska, is water quantity issues. So flooding, drought, it's where you really get that interaction with climate, but then also water quality issues. And we know here in Nebraska, we face a number of water quality issues, everything from high nitrate concentration to arsenic and a variety of other issues as well. And as Melissa talked about yesterday, we understand that changes in our climate, such as drought, can potentially have impacts on water quality as well. And so when we think about water, it's usually in this context. We can think about it as either we have too much, too little, or it's not clean enough. And all 3 of these, as we've said already, are related back to climate in a variety of different ways. Too much is flooding, too little is drought, and not clean enough can be the result of a variety of different things that climate can also potentially influence. Everything from a rise in temperature to changes in precipitation patterns, either for the more or for the less. And I want to talk about that a little bit more in depth as I move forward through my presentation. And so that really gets at that nexus of water, climate, and health. And because this is such a broad, engaging topic, you need a lot of expertise to really try to understand what are some of the impacts, but also what do these potential impacts mean for society. This is everything from social scientists, public health officials, to geochemists, physicists, and on down the line, and anyone in between that spectrum as well. And so that's one of the interesting and engaging opportunities that we have at the University of Nebraska around this new initiative that we have, is trying to get at what are some of these ways that we can build linkages across our campuses to try to help address some of these very complex problems. And so when we change our climate, we change water security. And, you know, I'm not going to go into this in too much depth because I understand that most of us are pretty aware of how our climate system is changing. We understand that our temperatures are rising, and we're seeing that across the United States, but also across the globe. We also know that our precipitation patterns are changing, and we're seeing that across the United States and also across the globe. In certain parts of the United States, for example, we've seen things get wetter. In other parts of the United States, we've seen things getting drier. So here in Nebraska, where I'm at, we've seen trends over the last 50 to 100 years that things have gotten a little bit wetter. And then in Arizona, the opposite has occurred over there. And those same kind of patterns have been seen all across the entire, across the world. And not only, you know, have we seen historical changes, but we understand that we're going to continue to see changes into the future as well. We expect that temperatures will continue to rise and precipitation patterns will continue to change. Here in the United States, we expect places like here in Nebraska to get a little bit wetter over the average annual, and in other places in the United States, a little bit drier. But there's also a variability based off of seasonality. In Nebraska, for example, in the summers, we're expecting that our summers to get drier and our winters to get wetter. But not only is the average annual changing, it's also the extreme events that are changing, are expected to change as well. We expect the hottest days of the year to get even hotter. And obviously, Catherine and Alan and I were talking about that at the beginning. But also the wettest days of the year to get wetter and our dry spells to get longer. And that's something we've already seen. We've already seen changes in our climate system and those extreme events, extreme climate and weather related events over the last 50 to 100 years. Extreme precipitation, especially in the Midwest and Northeast, has gotten more extreme. Floods have become more frequent in that same area. We've seen changes in hurricane intensity and frequency, especially with larger category storms. Sea levels have risen. Winter storms have become more frequent and intense. Droughts, especially in the West, have become more prevalent. And along with drought, you see things like heat waves and wildfires that have a natural association with those types of events, with those drought-like event or drought conditions. And that's across the United States, but we're also seeing these same patterns globally. And one of the things that you will notice with this is that many of these are linked back to water. Changes in extreme events and extreme climate and weather related events are tied to water in some capacity. And when you look globally, you find the exact same pattern. About 74% of global natural disasters from 2001 to 2018 were water related in some way. And so not only are we seeing these changes over time, these changes are having impacts in the intensity, because of the intense changes in the intensity and frequency of these extreme events, they are having impacts on our society around us. Over the last 40 years, the NOAA, National Oceanic and Atmospheric Administration here in the United States, has been monitoring billion-dollar disasters. And so these are disasters that exceed, climate and weather-related disasters that exceed $1 billion of economic loss. And they've been monitoring these since the 1980s. And one of the things that you can see over that 40-year time span is there's been an increase in billion-dollar disasters across the United States. That's partially due to the changes in the frequency and intensity of some of these extreme weather and climate related events. There's other factors that play into that as well, and those are both social and economical impacts as well. But this all came to head last year in 2020. We thought of 2020 as a pretty rough year. You know, we had COVID, and that caused a lot of issues across the United States and across the globe. But we also had a record-setting year for number of billion-dollar disasters, climate and weather-related disasters in the United States. We had 22 of these events. That was our first time in the US history, or over the last 40 years since we've been monitoring this, that we've seen that many of those types of disasters. And we had a record-setting year for total cost as well. And so we're better understanding some of the dynamics of how these extreme weather and climate related events are occurring. We're better understanding the physics and natural processes that drive this, and we're better understanding the human caused processes that drive this as well. And so for a long time, when a natural disaster occurred, a climate or weather related disaster, it was difficult to say whether or not that was caused or there was any influence on that disaster because of climate change. But today, where climate science is standing, we have a better understanding of some of these relationships. And so now we have things like attribution analysis, climate attribution analysis, to actually understand that certain extreme weather and climate related events have a stronger linkage to human-caused climate change, with heat waves, coastal flooding, extreme precipitation being at the stronger end of understanding, scientific understanding. And so we can look at an individual event today or a series of events that have occurred and look at those particular events and actually identify a signal and see whether or not climate change, human-caused climate change, is potentially increasing the frequency or intensity of that particular event. And so now we have an opportunity to better understand when one of those events occurs. And because it was maybe more intense or longer lasting, longer duration, or whatever it may have been, we can now understand what are some of the societal and human health impacts of those particular events. And that's some work that I've done with some of my colleagues and a student from over here at the University of Nebraska Medical Center. We worked in partnership with the Society of Actuaries. This is the large national, international society for actuaries, insurance actuaries. We worked with them to create this case study of looking at how we can actually use attribution analysis of climate-related disasters or climate-related events to actually understand what are the potential human health impacts, but also linking that back to economic impact as well. And what was the extra burden of cost because of those events on our healthcare system? And so this is, I think, a unique and interesting opportunity to try to better use some of the climate science that's out there to try to better understand what are the impacts of climate change today. And we understand that climate has an impact on our health. Like I was mentioning earlier, going all the way back to Hippocrates and Tilton to present day, we understand that there are direct or indirect or delayed impacts that are associated with changes in our climate. Direct impacts are those things that hit immediately. They are the things that send people to the hospital immediately. Extreme heat events, air pollution, extreme weather. When these types of events occur, you can see a surge in hospitalization. But then there's also the direct and indirect or delayed, the indirect or delayed health impacts. So this is spreading of disease, destroying of food supplies, disruption of well-being. And there's a variety of different pathways to get to those human health impacts. But these are the things that happen a little bit longer, over longer periods of time. And, there's been a number of big scientific assessments and reports that have identified and looked at some of these relationships. This was one that came out of the White House in 2016. I was one of the lead authors on this particular report. This report brought together, this is through the US GCRP, or the Global Change Research Program. It brought together experts throughout the federal government to try to understand what are the impacts of climate change and climate on human health. This report, large institutional, multi-institutional report, came up, it was multiple years of investigation. And there were two main impacts that came out from the very beginning of the report. And that was one, that climate change is a significant threat to the health of the American people. And the second was that every American is vulnerable to the health impacts associated with climate change. Other reports have since followed, and other reports even began before this. But, like for today, currently we have the Lancet report. They do the global countdown, where they look at the impact of climate change across the world and what are the potential health impacts. And we're able to identify that they basically say the exact same thing, that climate change is a threat to human health across the globe. And so this is from my former office where I worked at CDC. And this you probably have seen in some capacity if you've ever heard a talk on climate and health. But that's where it originated, was at CDC. And so this is just all the different ways that changes in our climate system potentially impact our environment in some way. Those changes in our environment then can manifest into human health outcomes. And as you can see, there's a variety of different ways that we can get to human health outcomes from changes in our climate system. And this pathway, I always put this up here because I think it's incredibly important. Although obviously much more linear than that fancy twirling design that was before this, this linear pathway has two parts that are, I think, incredibly important that are not in that previous diagram. So we have up at the top, we have the climate drivers, the exposure pathway, which is changing the environment in some capacity, which then can lead to human health outcomes. But on the outsides, we have the gray boxes, and that's the social and behavioral context and the environmental and institutional context. That's one, the community that you live in, the individuals that live around you. Who are they? That is the social and behavioral context, age, gender, race, ethnicity, poverty, housing, infrastructure, education, discrimination, pre-existing health conditions, access to care. And then over on the other side, you have environmental and institutional context. So that's the land use change, ecosystem change. That's what the actual infrastructure and environment looks like around the communities that you're investigating. And changes in those gray boxes from one location to another can lead to either more human health outcomes with a climatic event or changes in the climate or climate-related disaster, or decrease the number of health outcomes. And so those are very important for as we're moving forward and trying to better understand how climate change is causing human health related issues. And so I said that all populations are vulnerable to the impacts of climate change, but certain populations are more at risk than others, especially here in the United States. This is typically communities of color, children, low-income communities, and older adults. And there's a variety of different reasons for that. Everything from pre-existing health conditions to access to care, to racism, to where the individuals are actually living, are they in more flood-prone areas, to a variety of other issues as well. And that's in the United States, but we also know across the globe, 450 million children live in water vulnerable areas. And so as our climate system continues to change, this number will continue to grow, and these particular children will be even more exposed in the future as well. So one of the big things that I work on is drought, and how drought is actually linked to human health. I heard this a long time ago, and I always put it up because I thought it was such a good quote, but it was basically that floods kill people, but droughts destroy civilizations. Well, droughts also kill people. Actually, over the last century, since 1900, droughts have likely led to more deaths than any other climate or weather-related disaster internationally. And that's primarily due to famine and malnutrition, with flooding being a close second. We also know that droughts, especially here, have changed culture, have changed political structures, have done a variety of different things. You can look back to the Dust Bowl of the 1930s that hit the central part of the United States and the major drought that occurred with that and the impacts that it had across that region. There's books written about it. And then connecting drought to health, especially here in the United States, is not always the first thing that we think of, because drought is just a little bit different than a lot of other natural disasters. Drought is a more slow evolving disaster. So you do not see the health impacts immediately, like say flooding or a hurricane or whatever it may be. So because of that, the impacts are not immediate. And there's sometimes it requires multiple steps before you see human health outcomes. And in addition, health surveillance is not designed to easily connect drought to health, because there's not an ICD code that a doctor can put on the patient's record to say that this person's in here because of drought in some capacity, where there are easier links with things like heat. And so this is one of the challenges. But as I mentioned before, like I said, internationally, we know that droughts have likely killed more people than any other climate or weather-related event. And so we need to better understand what that actually means for human health outcomes here in the US, because drought is a threat multiplier. Right now in the United States, we are facing a large drought in the western part of the US. Droughts can lead to heat waves, wildfires, decrease in water availability and water quality, can reduce air quality, and then also lead to changes in vectors and exposure to certain pathogens as well. And so, again, this is kind of a similar diagram as before, but with that, drought changes the environment in a variety of different ways, which then is based off of changes in the climate, which then can lead to changes in the environment, which then can lead to a variety of human health outcomes. And so that's some of the work that we're trying to do is at the University of Nebraska with the team that I have to better understand what are some of those linkages to health and what does that actually mean for human health impacts. One of the more complex ones is the one related to mental and behavioral health. Anecdotally, we all have heard stories like this before where talking about how, and especially in rural communities, agricultural-based communities, when major droughts occur, you can see extra stress on those potential communities. And there's stories that have come out of Australia, India, Africa, and even here in the United States that shows an increase in potential suicide or links to depression associated with major drought events that have occurred. And this Kansas farmer, when they asked this particular farmer in Kansas about high suicide rates in farming and agricultural, with farming and agricultural workers, he said, nothing gets a farmer down more than a drought. And so this is some work that we've been working on to try to understand some of these types of pathways and thinking about some of these more complex pathways to human health outcomes. And so down here in the far left side of the screen, we have a drought event, and then each of these nodes is a potential stressor that eventually can lead to a mental health outcome, whether it be depression, anxiety, or suicide. And so this brings together all these linkages. And so you can see how complex this is, and that's, I'm not putting up here so you can memorize all this, but you can see how complex some of these linkages are. But we need to understand these linkages because they do have important impacts on our society around us and can help public health officials and other officials help prepare and reduce those impacts as well. And this is work that's already been ongoing. CDC has been invested in this. And so when I was at CDC, we were working on things that were trying to show linkages between drought and health and providing information, especially to public health officials that are in the middle of drought, on how to respond and understand what are the potential health threats. Because like I said, drought is not typically thought of in the same way as other natural disasters. Drought is typically thought of in the context of agriculture or water resources, but it's not typically thought of in the context of public health. But there's a slow change in that, especially with some of the major droughts that we're facing and the changes that we're seeing in our climate system that is leading to more intense and more frequent droughts as well. And this is where we're kind of trying to bring together the physical science and the public health into one room to better understand what are some of these linkages. So this all kicked off in 2019. We had a drought and public health summit that was in Atlanta, Georgia. We worked with the Centers for Disease Control and Prevention, NOAA, and a variety of other institutions to pull this summit together. It brought experts across the federal government to try to understand who's doing what on drought and health. What are some of the opportunities moving forward, and what is some of the best practices that are out there? One of the things that came out of this was a need to better understand what's happening at the local and regional level. And so before COVID, and we had a series of workshops that we were hosting across the US to try to bring together experts that were looking at in the public health arena and also in the climate arena, bring them together to try to understand what is going on in the context of drought and health, and what are some of our gaps and what are some of our opportunities moving forward. The purpose of this is to help NIDIS to create a strategy document. NIDIS is the National Integrated Drought Information System. It's an interagency group, interagency institution that's mostly housed in NOAA, National Oceanic and Atmospheric Administration. But yeah, and so we started this off, then COVID happened, everything shut down, and now we're in the process of starting these workshops up. And again, the premise of this is to try to bring together experts to understand what is going on, what's happening, and what are some of the needs, so that we can fill that into the strategy document to help better build capacity here in the United States in addressing public health issues associated with drought. And so quickly, before I transition to the last part of my talk, the impacts of climate change are now. And those impacts are broad and widespread. The Syrian conflict is potentially one example of that. Some people have linked back the situation that occurred in Syria with the 400,000 people, over 400,000 people that were killed, over 5 million refugees out of the country, to climate, and to, in particular, a major drought event that happened in that region. This is very complex. There's a lot of different things, and you can actually do an entire presentation on this easily, or a series of presentations, but I'm going to try to summarize it the best that I can. So there was this major drought event that happened in the region. The major drought event impacted rural communities. Rural communities had difficulties sustaining their livelihoods because those agricultural-based communities no longer had the water resources or the food availability to really sustain. Part of that population started moving into urban areas. When they moved into those urban areas, they were also looking for assistance. Those populations became disenfranchised and were looking for help and support in some way. When they didn't see it, they started a protest. That protest was met by the government with violent opposition. Violent opposition led to the horrible things that happened afterwards. And one of the things I want to say is that people have looked, climate scientists have looked at that particular drought event that hit Syria and throughout the Middle East, and they've actually seen that drought event was more intense and longer lasting because of changes in our climate system. Now, I'm not saying that climate caused this particular event. It was potentially a trigger of this event. Obviously, the cause was the Syrian government's response to the situation. So public health, as we're talking, we're moving forward, and we're talking about all these different opportunities. There's a lot of opportunity to engage public health because they've already built a community around this in some capacity. Public health educates the public. They enhance monitoring around some of these health threats. They do research, and they contribute to public dialogue. And so as we, especially those in the more geophysical science realm, are diving into some of these topics in the context of geohealth, there's an opportunity there to partner with public health on many of these issues, because they've been doing this work for a long time and know how to engage communities and know how to be stewards in a variety of different ways. But there's also challenges, and we understand those challenges. When we look at total public health spending in the United States, total health spending in the United States, only about 1.5 to 3% of all of our spending on health is actually towards public health. So it's a very small percentage. And you have to break that down to even a smaller percentage that are worried about some of these environmental related issues, especially climate. And we also know that we aren't seeing action across the United States when we are talking about some of these issues as well. There are 51 countries in the US or around the world that are devising plans to address the health impacts associated with climate change. And the United States is still not one of them. And so just to finish up here, I think I'm right around time. Climate change is a threat to our health. Climate change causes water security issues. The threats from climate change are happening now, and we need to better understand those impacts that are happening now, because those are threats currently. Climate science is allowing us the opportunity to identify how climate change and human-caused climate change is actually impacting us currently. So there's a real opportunity there for integration. And the links of climate are complex, and so it's going to require multiple disciplines to engage these very difficult topics. And engaging public health and healthcare will only provide for better opportunity to help effectively communicate to the public. But I also threw this up here, and this was kind of a last minute thing. We still have a major hurdle when we're talking about any of this. whether it's climate change, environmental change, whatever it may be, and that's scientific literacy across the globe. I put this cartoon up in the top right because I sent it to some of my colleagues that were working on COVID-19 over here at the University of Nebraska. And I thought it summarized everything quite well, that we need to be innovative in how we engage this problem moving forward, because scientific literacy is a major issue across the board. And honestly, I don't know how to tackle it, but it's something we need to definitely address, because within this room, this virtual room, we have the intellectual capacity to probably solve any problem that we want. But solving a problem without actually being able to engage the public is definitely going to be a major challenge if we can't figure that out. It'll be useless, pointless. So acknowledgements, there's a variety of different people that I would like to thank for this opportunity. And then lastly, if you have any questions, I'd be happy to address those. So, Kathy, I was thinking, should we just go straight to the next speaker?
I think that would fit in our timeline. We probably have time for one question or two at the most. We're a little more relaxed on time today.
I guess that's a good point.
So are there any questions? I have just one comment, I guess, with regards to your last statement, which is something I've been thinking about a lot lately, as I'm sure a lot of people in the room have been, which is education's really, really wonderful, but we've also got to make sure that we start young with the critical thinking skills that are necessary to absorb and think about all the information that's coming at us. Because there's a lot of information out there, but without having those critical thinking skills to sort through it and evaluate it, we're going to have a problem.
I 100% agree. And, you know, COVID really, you know, I've worked on climate change for a while. And, you know, it's always been one of my issues is that false information gets out there, and there's a variety of different ways that false information has influenced this. But you saw the impacts that had on COVID-19, and it had incredibly horrible consequences because there was a distrust in science. There was a lack of critical thinking when it came to information that was provided and potentially going down the wrong pathway for which information to use or to support. And you're even seeing that still as we move forward. And, you know, we saw 500,000 people here in the United States. And honestly, it could have been much worse. And we're seeing what that could look like across the globe. Yeah, we need to be more creative in how we engage some of these topics. And I agree with you. Starting early is obviously the best place to begin.
And then we do have one question in the chat box from Jennifer Edmonds, which is how much of the public communication of these issues is done through online resources, printed resources, or in-person outreach, and which one might be more effective?
I'll start with the last part. Which one is more effective? I think I don't know if I would say any one of them is more effective than the other. I know when we're trying to do our education and outreach with local and state public health departments, a multi-prong approach seems to be the best way, because certain people are going to pay more attention to social media and they want the quick hit of information. Can you digest it in a minute? Some people, they want a little bit more facts and information. And some people, don't want any of those things. So, but with the public communication, I would say let's see, I was looking at that first part of the question. online resources, printed resources, and in-person outreach. Now, as far as our new program that we're creating, right now, a lot of that has just been in-person outreach. What we want to eventually get to is providing more online resources and printed resources for individuals, so that we are hitting that multiple prong approach for doing education outreach across the state. Because there's a lot of different ways that we need to help people better understand, especially in the context of climate, how this is actually impacting our health right now, today, in the communities that we live in. And honestly, we're way behind the game on that. If you look across the board, there's only 20 states that are actively receiving funding to work on climate change and health assessments and provide some of these materials, Arizona being one of those states. But that's obviously a large percentage of the United States, for example, that is not getting those resources to actively engage around some of these issues. And so if they are, they're either doing it on the side or they're not doing it at all. And as I showed, last year we saw $22 billion disasters, and each time one of those disasters happen, there's potential human health outcomes occurring because of it. And we're obviously not messaging and not doing enough on that end to make sure that we're better prepared for the next year that we have another 22 or more billion-dollar disasters, which will likely happen sooner than later. I don't know if that answered the question fully, but
I think it addressed the question pretty well. So I think you got there. I think it comes back to what Crystal's been advocating over the course of the 3 days, which is communication is really, really critical. And that's something that we all have to start figuring out how to work on much better, because we won't get the critical thinking skills without educating the public about not only how to think critically about it, but what the issues really are. All right, back to you, Jesse.
All right, well, thank you so much. I really appreciate it. And I'm going to transition now over to Dr. Yusong Lee. Let me just see if I can pull. So as I said, Dr. Lee is currently a professor in the Department of Civil and Environmental Engineering at the University of Nebraska. She received her PhD from Vanderbilt. The goal of her research is to protect and restore environment and water resources based on a fundamental investigation of complex physical, chemical, and biological processes that govern flow and transport of contaminants in the environmental system across multiple scales. And so with that, Dr. Lee, I was wondering if I can transition over to you.
Thank you, Jesse. I'm going to share my screen. Hope everyone see my screen well. Thanks to Jesse for a very good presentation from the very broad aspect. And as one of the points Jesse was trying to address, that threats from climate change are happening now. And today, my talk is trying to show you as an example, I would say, case study. Maybe you think about a global issue and now you are using a microscope to really zoom in on this field site. And we are going to show you that climate change is going to impact water quality. And if people drink contaminated water, there will be the health issue. So I'm going to show you how we're trying to quantify that from the modeling perspective. So the title of my presentation is Uncertainty of Atrazine Leaching and Accumulation Below Agricultural Lands Under Future Climate Ensembles. I would like to start by acknowledging my co-authors. Chuyang Liu, he's a PhD student, co-advised by myself and our third author, Shannon Bartlett Hunt. So Chuyang is the person who actually made all those work. And this is a significant part of his PhD dissertation. So we are going to talk about the atrazine, and I'm sure many of you are familiar with atrazine. It is a type of herbicide that does not occur naturally. I have put the molecular structure of the atrazine over here. It was used to kill broadleaf weeds. It is contained in over 300 products. Some of them are for like family, like personal use. Some of them you need the professional license to use it. It has been commonly detected in groundwater. And there are different health concerns related. People have found that you would have higher rates of birth defects in babies' faces and skulls if mom live in those areas that has atrazine, applied atrazine. Babies could grow slower and had a smaller head circumference than babies whose mom were not exposed to atrazine. And women who drink atrazine contaminated water could have delayed period, and people can have higher risk of end-stage kidney disease. So this has been a concern. EPA has set the maximum contaminant level is 3 microgram per liter. So the objective of our study is trying to understand with the climate change, what would be the concentration of the atrazine in the subsurface, in the agriculture land. And our study also trying to consider a lot of uncertainties when you do the modeling. The uncertainty of the different parameters could occur, and how the uncertainty of the climate and the site would impact your prediction. So this is a map of the annual atrazine use in the US. And here's our site in Nebraska, which is Nebraska Management System Evaluation Area. This area has underneath has groundwater, has atrazine concentration average. I will show you some broader data later as 1.57. And we are going to we choose this site really because this was a university research site. So let's give you a little bit of the zoom in from the global and pretty much microscope that this is a site that was well managed in university, at the University of Nebraska-Lincoln in 1990s. At that point, they have some like planned agricultural activities, grow corn, and then they put in a lot of sampling holes so that we have very good understanding of the site. And in our previous research, we also use this site to, we sampled this site to about the nitrate contamination. So we had some experience of this site. So the goal is to try to figure out how the climate change is influencing the atrazine in transport. So here's what we do in terms of the overall frame. We build an atrazine accumulate and transport model on this particular site. And we try to start by historical condition, trying to make sure our model works okay under the historical condition when we have data to compare. And then we apply the future climate scenarios to this transport model. So in order to figure out the transport of contaminants, we look at depth of the soil beneath the agriculture land. So groundwater can get into the domain, sometimes in, sometimes out. So we need to figure out the groundwater elevation. In order to do that, we trying to figure out what is the future groundwater recharge. And then with the groundwater recharge, we figure out the groundwater elevation and feed that to the transport model. So this is the general, you will see this plot several times, really just to assure you where we are, because it's kind of different pieces together. So this is another way to look at our modeling framework. We look at the climate in the historical period from 1991 to 1994 and get the model running. and get model kind of calibrated, not really calibrated, just make sure it is reasonable. And then we apply the future climate scenarios based on the predicted groundwater recharge and ground elevation, and then trying to estimate the concentration based on the uncertainty of the sites. As a start, I will just start talking about our atrazine transport model, because this is a key part. And for each scenario, we do like hundreds of the simulations for one climate scenario. So this is a site that we built on. We got the soil samples of the site and built the lithology of the site. We consider the water flow. We consider the precipitation, irrigation, and evapotranspiration. We consider the root water uptake. And also on the bottom, we have the groundwater level change with the variable, the pressure influence. So water system is simulated. In addition to that, we simulate atrazine transport. Atrazine transport together with water and also have other processes. We also consider the sorption of atrazine onto the soil and also the degradation of the atrazine after it gets into the system. We consider, because like, if you wanted to get a little bit better understanding, you don't want to limit your results to this one single site. So we're trying to get a range, understand the probability or the uncertainty of the parameter. Atrazine concentration in groundwater is one thing that we're trying to get the data from the Nebraska clearinghouse. And based on the concentration we're trying to understand what is the probability of the atrazine concentration. And we also do the same thing for the atrazine application rate based on people's the data on how the people applicate, how much they apply the atrazine. We also, based on literature, get the probability of the atrazine degradation rate with in a similar site, the agriculture land scenario, and also consider the sorption. All those are the probability function that we consider. With that, we use a method called Latin hypercube sampling method to help us to generate about 100 sets of the variables based on the range of the data that we got for those 4 variables. And then we apply those parameters to the transport model. And then we trying to get what is the concentration on this site. So with this, we can get for each climate scenario, we do 100 simulation. And then with that result, we can get an average average concentration and average mass distribution, as well as a range of the standard deviation, maximum, minimum, all those information. Okay, so I will first talk a little bit about our historical condition really quick, and then we'll get into our future climate scenario. So this is just really quickly to show you, I don't mean to get into any detail of those data, but as I said, there are a lot of sampling on the site. So we were able to trying to say that whether our data, our model reasonably reflect the historical condition, because all the parameters are not just confined to this site. So we are not doing real calibration. So, and the disadvantage is that we only have the data in a saturated zone. So in the middle zone, we don't really do calibration, but we essentially, this plot show you the model is reasonably reflect the field condition. With that, we apply the model to the future climate scenario. Okay, so we considered 20 future climate scenario. They are all from RCP 8.5, which is the condition with high green gas emission pathway. And those 2 plots really I just want to show you that the average and the standard and the some statistics of the annual precipitation and the annual evaporation of the 20 evapotranspiration of the 20 climate scenarios that we considered. And you can see they have pretty wide variety, pretty large variety. And with this climate scenario, next thing we do is we wanted to figure out at the location of our site, what would be the groundwater recharge in the future would look like. So we used a method called inverse Vadose zone modeling method, which I'm not going to get into the detail. Essentially, what we do is we set up a water flow model on the site, and then we're trying to simulate a water flow model by optimizing the hydraulic parameters. And we compare our simulated soil moisture data with the field obtained soil moisture data. And with that, once they are best matched, we look at the groundwater flux, leave the lower boundary, and give us the future groundwater recharge, the groundwater recharge. And we use the 20 years of the soil moisture data to validate and then apply for the future scenario, future climate scenario. So that is how we did that. And here are the predicted future groundwater recharge. And we don't have to get into the detail. One word is that we predicted that in this area, groundwater recharge will be greatly reduced in general. If you look at those points, those dots are the historical data that we collected from the field, and those are the average and the 75 percentile, 25 percentile range for the future. So groundwater recharge will be reduced in the area, which is not as surprising because people have been predicting the similar trend for the area. So with groundwater recharge data, we put that into our groundwater model. The groundwater model is built in the area of a little bit larger than our site for the transport model because we need boundary condition to make it work. We set up a 3D groundwater model and then apply the groundwater recharge to it and then simulate how groundwater elevation change over the future period from 2060 to 2059. 2056 to 2059. And you can say that we predicted that even though we also calibrated the model first based on the historical period, and from 1991 to 1994, the groundwater level is like fluctuating, but kind of increased a little bit. But our simulation shows that the groundwater elevation is decreasing. In those 3 years of period, we predict that it's averagely will decrease for less than 2 meters, but that is pretty significant. So with those information, we feed that into the atrazine model, transport model, and trying to see what's happening to the atrazine transport. Okay. So first, this plot shows you the mass accumulation of the atrazine in the future. So on the bottom, you see all those numbers. Those are the future climate scenarios, 20 that we simulated. And here, please remember that one climate scenario contains 100 simulation. And the data showing here is the average. And here is the time from July 2056 all the way to June 2059. And people apply atrazine typically sometime in May. Okay, and so in the first year, essentially with the starting of the simulation point, people has already applied. So the general trend is after you apply atrazine, the amount of the mass in the domain have a jump up, it's increased, and then it's gradually reduced. And the next year it will it will, when you apply, it will increase again, and then gradually reduce. And if we look at their data, you can see that the top plot here is the maximum amount that we get averaged from all the scenarios. It's gradually increased. The reason it's decreasing is because of the degradation, right? After you apply, you get into, and then it's degraded. And then the one on the bottom is the minimum, which means that what is left at the end of the season. Those are the values that I actually feel will be very important, because those are the atrazine actually stayed inside the soil, and eventually probably will be able to get to the groundwater. So those just really, like, in summary, tell us different climate scenarios have great impacts on atrazine mass accumulation. And we also say that the mass will accumulate over time under the future scenarios. And this plot shows you some information about, we try to see what are the factors that actually impact the mass accumulation. And we look at the different factors, and I just wanted to show you this one is the precipitation. And you can see that we look at this is a whole domain, 3D domain, and we look at the sub-region of each domain, and we found that in the on the topsoil, when you have higher precipitation, you actually, the mass reduced because it's getting to the second layer. And in the middle layer, it is largely correlated to the mass accumulation of the atrazine is largely correlated to the precipitation. So this really tells us that precipitation is a very important driver for the contaminants get into the soil. And we're also trying to look at the transport of the plume. So what we did is we try to look at the concentration of the atrazine that at the front, when you have the concentration as 3 microgram per liter, which is the EPA setup MCL, and we check where did that go. I'm sorry, I have this depth here. I forgot to, for whatever reason, forgot to delete. Please ignore that. So we're trying to check where is it, so that we know how quick those atrazine that applied from the surface will get into the subsurface, get into groundwater. So again, this is the same plot as similar plot as before, that we have 20 climate scenario, and for each one is an average of 100 simulations, and you see the time from 2056 July to the June of 2059, and you can see that because the beginning was already past the band application, but after band application, it's just kept going down, and the depth is keep increasing over the time. If you look at the plot on the right, which summarized all the data, all the climate scenario, you can see that the plume depth, the maximum plume depth is increasing. The minimum plume depth also, this means that while it is going down, but simultaneously we have biodegradation. So some of the lower concentration part will be degraded, and then plume will going back. So if you can like visualize it like a plume coming down, but the edge of the plume is degraded, and when you have the strong degradation, the front looks like going back a little bit. So that is where you have this minimum annual plume. But you can see that with time going down, the atrazine is going down, moving downward to the subsurface, towards the groundwater. So it's moving deeper, and the groundwater level is 4 meters in our site. So after 3 years, it's not there yet, but if you keep going on, it will be there. So this is another plot showing you the atrazine plume front and depth. This shows you all the data that we have, and I just wanted to point out that this is the front of the plume below the ground surface. I just wanted to really point out the extreme condition. So this is the extreme condition we extracted from all the scenarios, which include 20 climate scenarios, and then under those we have 100 simulations for each. So that is 2,000 simulations. And it shows that in the worst scenario, this may not happen because this has a combination of the extreme climate and the extreme site condition that really facilitate the transport. But in those very bad scenario, in 3 years, atrazine plume can move down as far as 6 meters. So that is getting into groundwater. On this side, the groundwater is 4 meters below the ground surface. So the other thing we looked at is we're trying to take a look to see how we consider the site uncertainty, because we have a range of concentration, we have a range of the sorption biodegradation band application situation, and also the climate impact. We wanted to see the relative importance of the parameter uncertainty. So on this plot, so this is x-axis are the degradation rate, and the y-axis is the normalized mass in a domain. And for every single degradation rate, we correspond to 20 climate scenario. So if you look at one axis and the range maximum, minimum, or mean shows you the variability due to the climate variation. And so you can see that for the degradation rate, when they are low, so this is the whole domain, and this is in a different subregion. When the biodegradation rate is low, you see a lot of difference between the maximum, minimum, and the mean, have some a lot of noise. And when the degradation rate is very high, you don't see a lot of things going on. So that means when the degradation rate is low, climate uncertainty really impact the uncertainty of contaminant transport where they are. And it is dominating. But when the degradation rate is very high, climate change doesn't really impact. The reason is that the degradation rate is so high, those atrazines get into subsurface, they quickly get degraded. So you don't really see a lot left. So climate variability dominates when degradation rates are low, and we have minimal impacts when the degradation rates are high. The other interesting thing I wanted to bring to you is for the sorption, we have the similar finding that when the sorption is low, is relatively low, it's not like hugely low, we see climate impact hugely. But when the sorption is high, it wouldn't, climate change wouldn't influence. So this has implication to a different site. So for some field site, probably you have a lot of soil organic in a site, then probably atrazine will be quickly absorbed onto soil organic matter. And then on those sites, no matter the future climate will be, the distance that atrazine can go, can migrate would be the same. But if it is a site that has a lot of mineral and not a lot of sorption, atrazine can move along easily. There's not a lot of bacteria. Then climate change, which leads to the water flow change, will really influence the accumulation and how far those contaminants can go. So, in quick summary, I hope as I said, I essentially bring you a microscope from Jesse's big picture onto this site. And I wanted to show you some take-home message. Essentially, we found that the groundwater elevation will be declined, and which could be a problem for this site. And we also found that rainfall is a major driver for transport atrazine in the vadose zone. And the climate variation in general leads to big uncertainty of atrazine mass accumulation transport but such effect is not obvious for the field site with very high degradation rate or absorption. And in the worst scenario, which, as I said, is the combination of the climate scenario and the site scenario, atrazine plume can reach really quick. It's 6 meters in 3 years, which I should put it over there. And that's all I have. And if you have any questions, if we have time to answer any questions. Thank you.
Thank you, Song. I really appreciate it. There's one question in the chat to kick it off with, and it's from Tate. He said that with climate change, increased temperatures, wind, higher erosion, could this change the soil profile and properties affecting factors for groundwater recharge, such as infiltration and water holding capacity? And this could in turn affect the groundwater recharge model and then exacerbate atrazine conditions, question mark.
Yeah, absolutely. That is a very good question. And my answer is yes. So our model is include a lot of assumptions. For example, we didn't consider what you just mentioned about how the soil property change would be impacted due to climate change. So we assume that the soil properties are the same. So I'm using the same set of the soil property. But yes, if we could collaborate with people who can predict the soil property change. So when we started to work on this, it's really, we found initially we think it's just a transport, and then we figure out, oh, water flow, a recharge, and you bring out another aspect, how the soil property change would influence. Yes.
Nice. And then we had another question from Azar. Thank you for the great presentation, obviously. And I agree on that one. Sorry for not bringing that up earlier. It is a wonderful presentation, very thoughtful and thought-provoking as well. But following up to Tate's question, what are the limitations of using a statistically downscaled models, LOCA, for future climate scenarios?
So I think one of the big thing that I feel is for us, we are kind of the user of the LOCA, and we don't really understand. So they have those climate scenarios are generated based on the different like essentially different parameter set, and there are uncertainties related to the climate model from LOCA by itself. And that part is a huge limitation for me, because that is a black box. We have to like stay on trust using their model. But that's the reason I'm talking about climate variation, because I'm using different LOCA model. But each model, I believe they have uncertainty there, which is a missing component we are not considering.
And Kathy, how are we doing on time? I see we have one more question.
I think we're okay for the one more question, and then maybe what we can do is take a 5-minute break and come out back to the breakout rooms.
Okay.
And we'll do about a half hour. Actually, I don't know. Alan, what do you think? Gabe will be back at 11. So we can take a 10-minute break, come back to the breakout rooms, and then come back.
That's what I'm
start our discussion.
Yeah, why don't we do that? Why don't we take a full 10-minute break right now? And then, so I have 10:17. So why don't we just come back at 10:30?
Right, and that means I think we have time to address one more question before we go.
Mm-hmm. Yeah.
And Yusong, I'll let you try to address this, but Alejandro said, I understand that this chemical is easily removed with activated carbon. Is it possible for local public officials to recommend installing simple filters in homes in affected areas?
Yeah, I think that is a very good thought. So I think people are trying to figuring out innovative ways to remove different those type of the chemicals. The problem is those are non-point source, essentially means that those chemicals are applied very widely on the field. It's very spread out. So the technology-wise, I think people are still developing to make sure it's if it is centralized, then it will be easier to remove. But it's large area that is still something under development. But this is very good thought.
So I think, Jesse, do you want to take the lead here in the post discussion, and we'll run through each of our discussion groups, our breakout rooms, and maybe come up with the 3 main points we heard, and then open it up to the group?
Sure. I'll kick it off with our group. We had a nice discussion. Again, communication was kind of the key. We're finding that over and over again, and especially when we're talking about having that local focus, so that you're engaging with your community and engaging with the research that you're doing locally. And then lastly, I would say, or in that context, is solutions-based. So when we're engaging and we're working with communities, making sure that we're communicating with our communities, but also when we're doing the science communication just in general, making sure that we're solutions-based so that people, you're not just stating a problem, but also stating what the potential solution for that problem is. Yeah, and then as Crystal pointed out, thresholds for risk, and understanding, identifying what are some of those thresholds for risk for better communication around some of these issues as well. And so with that, I'll open up to the group if anybody wanted to make any last points or comments. Or any additional points and comments.
All right, maybe Alan, you want to summarize your group?
I was feverishly looking for the unmute button, which I finally found. Well, I'd have to say that in our group, I don't know how the random generator did this, but our group was an aggregate of incredibly optimistic individuals. So I think we were really looking at the glass half full. So it was interesting. We started off talking about, and just like what has happened in the last few days, the conversation really had 2 parts. It had a science part, and then it had a communication part. In the science part, we were like Star Trek. We were looking into the future. We were talking about futuristic modeling and how this can move forward, and how unexpected eventualities may play roles. So kind of secondary or maybe even tertiary impacts that have arisen from climate change, kind of like what Jesse was talking earlier about today, like vector-borne diseases might really become important, both important socially, but also scientifically really, really interesting. Then we started talking about education and communication, and again, the optimists rose to the front, and we talked about the fact that people know what's going on. It's just right now we live in a unique point in time when things have been so politicized, and the political environment is so black and white. It is so binomial that everything is an issue, and every possible thing. Cotton candy becomes an issue, pink or yellow, right? I mean, everything becomes an issue. So, but with that said, you know, the inherent vein of optimism of people know what's going on, and perhaps just like happens historically, as the political winds of change blow past, maybe more positive days are coming in the future. So how's that for a summary?
That's very, very nice. It's good to hear optimism. I'm very happy to hear that. And I also like, we've gone now from the rhyme of the ancient, well, actually from Jesse's talk today to all the way to Star Trek throughout the course of the week. So this is all good. We're taking a really broad view. And our group, I have to say, I won't say we were optimistic, but I think at the end, we still have an optimistic message in the directions moving forward. So the first thing we talked about, and Alejandro brought this up, and I think it is really, really important, is the interaction between climate change and not just one chemical, it was great to see Dr. Lee's presentation today, because I think it's really important to understand what's going on as drought situations occur and water situations occur. But there's also all these interactions between compounds. And we've got a multitude of organic compounds here, and we haven't spent a lot of time this week talking about them. But he even brought up a paper of an interaction between arsenic and glyphosate, and how those two interacting together can lower the effective concentration for negative human health outcomes. And so starting to look at those combinatory effects, I think in the context of climate change especially, but even on their own, we've been saying this forever, but it is really important and necessary. And then Ella brought up the importance again, so we come back to communication and stakeholders and education, but that the stakeholder chain isn't just a chain, that we could all use Jesse's network model for the stakeholders and how these stakeholders interact with each other. And in the middle is really going to be the governmental action. Without that, not much will probably change, right? That's the source of a lot of the funding, and it's a source of a lot of the policy. And so there's this network, stakeholder network, that has arrows intersecting and arrows that ultimately end in that policy framework and realm. And so, and that this is not just an individual country problem, but a global problem. And so finding ways to intersect with those agencies that have a global perspective is really, really important, but of course also really dependent on the local, regional, and country politics, as we have seen, of course, over the course of the last number of years. And then Jagadish also had a very important input on communicating the science. So we're back to communicating science again. We need to do that way more effectively. It goes back to what Crystal's been saying all along. And Crystal put an interesting note into the chat box during the talks as well, which is that science communication is not the same as science literacy. And she provided a guide for a climate communication guide that's out there to help communicate the importance and the problems associated with climate change. So that's what came out of my group. So I guess, you know, the big thing, Alan and Jesse and Shannon and all of us, Gabe, is where do we go next? And I think, Gabe, you're the one that's going to lead this conversation.
Well, thank you. I'll do my best. Really, I'll just probably tee it off, and then I'll let us collectively lead it. It seems like all of these conversations, this group is so amazingly synergistic. It's not like you need a great leader and a bunch of followers. Actually, just the engagement's been pretty incredible. Having said that, I apologize for missing several of the breakouts because of previous commitments. But so I came to this thinking, while preparing my presentation for Monday, thinking, well, I'm going to prepare this sort of overly broad, optimistic view of, well, we need to, be working with communities. We need to focus on science translation. We need community partners to be in it from the get-go. Thinking like, okay, I'm going to be talking to a bunch of scientists. I'm also a scientist, so I actually have, I publish papers as well, but I care about the bigger scope. I was thinking, well, then I'm going to have a bunch of people who'll be like, oh, God, thank God that one's over. So we could talk about, arsenic speciation or, whatever. But my God, every conversation that's happened after that has informed me incredibly about your all collective issues with passion for communication, issues with communication, and your own thoughts about stakeholders, what that means, what stakeholder engagement means. And importantly, what a lot of you guys pointed out, and one that I grapple with all the time and I have very little solutions for, is how do you communicate risk in a way that is holds true to your science as a scientist, knowing that uncertainty exists, right? How do you communicate that risk in an effective way so that you're not just scaring people, or you're not being far too, well, either way, that you're not being too conservative or too liberal with your formulations of risk. And it really makes me sort of realize, and this comes back to something that's come up again and again, this whole idea of communication, is that scientists, frankly, we do a terrible job of communicating risk, because and this has plagued the climate change community for so long. And Jesse, I'm sure you're well immersed to this. We're so uncomfortable talking to a journalist to say that hurricane is, likely had its impact because of climate change. Yes, there's always been hurricanes. However, this was particularly destructive. We just have an aversion to getting out in front of that. And you guys all have many more examples than I do, I'm sure, but I certainly have that personal example when communicating risk. So the way I kind of view this in terms of maybe further discussion is how you frame, we each have our own area within GeoHealth. I understand that. And we each have our own valuable experiences in dealing with multiple stakeholders. So nothing that's come up, I think, in these discussions has been incredibly, shocking when you hear stories after stories of people's own, interactions with stakeholders or their own challenges with communication. But I would leave with two observations, and then you can disregard what I've said for the last 5 minutes and go about real communications. One observation comes back to something I said sort of early on, is that I'll speak for myself, but I might be speaking for most of us. We've had to learn through the School of Hard Knocks how to do science communication, how to think about risk, how to engage stakeholders, right? Because most of us have, our PhDs based on lab or field research, in our publication, our dissertation is all in publications, right? And so we weren't trained this way. And I'm not saying our advisors were terrible for not doing that, but it's a different world, I think. And we've let science diverge from the public knowledge, I think, because for so long, people just believe scientists, from the nuclear age on, it's like, oh, scientists, they've got white coats, they're, quite believable. We're seeing that shift a little bit under our feet as politics, as you mentioned it, I think earlier just now, about the partisanship of politics has also meant a little bit of distrust in science and scientists themselves. So first, I think we need to train the next generation how to do this better. I'm not saying I'm not saying stop publishing papers in journals. No, you've got to do that, but be aware that you need to build ethics, equity, and communication into graduate curriculum. And you need to figure out some way to, this is just my opinion, I hope you know that, some way to support that. And second is, once these graduates come out in the world and are young scholars, you need to figure out ways to support their continued research, which embodies this ability to get promotion and tenure while still doing community engaged research, right? If people ask me at my university, I do a ton of community-based research, but that's after I got tenure. If they ask me now, well, would you recommend I really focus on community engaged research in the sciences to get tenure? No, you'll not get tenure if you do that with focus. And that's too bad, because that's how our institutions are built. But I say we also need to rebuild our institutions. And the best way to do that is make sure that the funding, that we pressure funding agencies so that the funding opportunities also align with that new principle of how scientists are more effectively engaged. Because I guarantee you, a promotion and tenure committee might, say, oh, I don't want to give them tenure because they got, community engaged research. Well, if they have community engaged research, plus a $2 million, NIH proposal or NSF proposal, guess what? They're likely to get more favorable reviews. And so I think the training of students has to then be supported by a new model for how we fund young scholars. And the nice thing about this group is that both of those are within our hands, right? We have the ability to think about the training part in our own programs, if you're an academic institution, at least. We also have everyone here has the ability to pressure national funding agencies to say, you need to pay attention to this much more carefully. I think we all have very powerful, genuine individual voices to provide in that conversation. And you know, if one outcome of this GeoHealth workshop is that we individually think about that more, that's great. If another outcome is we actually band together for those who are interested and make sure that happens, put a collective voice behind that, well, all the better. So that's me just opining about what I've seen the last 3 days of an extremely exciting workshop. So I want to thank the organizers. Brilliant idea. I had no idea what to think when I was coming to this. And my expectations have been far exceeded. So thank you. That's all. I'll mute. I've left everyone in stunned silence. They're like, who was that guy?
No,
I'm go on, Alan.
No, go ahead, Kathy. Go right ahead.
I so completely agree with you. And I think I like the idea of maybe getting a group together to really start speaking to the funding agencies, both the NSF and the NIH. I know when I send my grants in that has a community component into it, but it's really, you know, there's the science, the biological sciences side and the social sciences side. It usually goes to a panel with a lot of biologists, and they completely don't understand the social science side of it. And they want details that you can't provide because the social sciences don't work in that same kind of framework. And then the grants sink. And that's just, you know, it tells you that, well, maybe leave that part out of it if I'm going to get funding. And as a tenured professor towards the end of my career, I just say I'm going to keep pushing it because I think it's so critically important, but I cannot tell my students to push forward in that way until we change the funding paradigms. And they do give lip service to it. They say we want interdisciplinarity, but it doesn't always come out with money at the other end. And some of you have been very successful at that, but it's a tricky process. Alan, you were going to say something.
Well, I think somebody else just had a comment right there, Kathy. So whoever was speaking, feel free to go right ahead.
Oh, I was just going to toss in, because until my most recent position in the last couple of years, I was 100% grant funded doing this sort of work. And that was almost entirely funded through USDA programs, because since its founding, almost, I would say, you know, that's been USDA's focus and extension service. I mean, there's a model for that, but it's mostly in the agricultural realm. But as you start to, and this is well outside of my area of influence or expertise, but as those of you who work with NSF or NASA, you could ask them to, or maybe even find the connections for them within USDA, because that's been their model of, you know, their primary target has usually been, this is being overgeneralization, but, you know, they wanted to get down to the individual farmer. And so they took that model from when they were founded a long, long time ago. And so there's models out there, even within the federal funding streams, that might be worth, you know, making some connections between them to show how it's been done.
You know, I have to chime in here. In that, I think it's, you know, one thing that's really interesting is that, at least to me, I don't know if you'll all find this interesting or not, but one thing that's kind of interesting is that the United States Department of Agriculture was founded by Abraham Lincoln. Why is that interesting? What Abraham Lincoln called the Department of Agriculture was the People's Department. And what I just heard right there, in a way, is like with 170 years of history, we've come full circle back to where we're now saying, bring, in a way, paraphrasingly, bring the people back into the scientific enterprise, if I can paint with that broad of a brush. So I think that's really, really interesting. The other point I wanted to make, and then like Gabe, I'll mute and let other people talk. The other point that I wanted to make was, I think while I would 100% agree with everything that Gabe said regarding young faculty and graduate students who are in this, listen to what I'm saying right now. It's certainly true that you're not going to be able to get a tenure track position or get tenure if your entire profile is community engagement, unless you're in a community engagement kind of department specifically, and I don't even know if those exist. So while I agree with Gabe that that's 100% true, I think the other thing, and I'll end on a note of optimism here, the other point that I would also agree with Gabe on, which he said on Monday morning in his initial introductory conversations, is the field of geohealth is emerging. And we're actually, and Gabe, I hope I'm not paraphrasing too broadly and bastardizing what you said, but we're in a way helping to shape, us collectively, the community of scientists in the world are helping to shape what that looks like. And perhaps from these conversations in the last 3 days, we can help to shape that in a way where having the community have a seat at the table from the very get-go is something that we can bring in. And with that, I'll stop.
And I would add that I think that there's a lot of power in engaging a more diverse set of voices. I mean, USDA has been under a lot of fire for how they've dealt with their diversity and outright discrimination issues. And so if we, from the beginning, most of these environmental impacts are felt more keenly, both in the US and globally by people of color. And so if we make it a point of saying that is essential to this field, I think there's a lot of power in that.
So let me add that, of course, one of the sponsors of this program has been the Center for Health Equity Research at Northern Arizona University, which was developed and run by Dr. Julie Baldwin, among others, and a number of us have been involved in it. But the whole goal of the center is to try to figure out better ways to get towards health equity at a broader scale. And so I think maybe within the academic realm, if you can't get departments to do this, maybe you can formulate these centers that are multidisciplinary, like CHER is, right? And it has a lot of social science going on and a lot of community-based participatory research and trying to get that communication out in ways that are culturally sensitive. That's the whole goal of CHER, is to do the research and communicate the research in appropriate and culturally sensitive ways. And they've brought together experts from across that broad range of the social and biological sciences to do that. So pushing your institutions to start having these more interdisciplinary kinds of programs is another potential outcome that can come from your individual work here.
So coming as a first year graduate student, when trying to acquire funding and think about research, would it be best to, I would say, focus more on the research-based, hard science, academic-based concepts of a proposal rather than include social science or like a social aspect or a cultural aspect. But how would you, I guess, address that as like a broader impact rather than like an intellectual merit? Because it sounds like to acquire funding, at least these days, from what everyone has said, you kind of want to not steer clear of the social science aspect, but it is an important aspect in why scientists are doing data research to improve public health, to improve, let's just stick with, but trying to improve public health. How would a graduate student kind of go about that when trying to write a research proposal or a grant?
So Tate, I have a couple ideas about that, and they largely, I will be encouraging. I know maybe my earlier words would have been discouraging, but there is some encouragement. And I think, so I'm more mainly an instrumental science. I'm used to doing instrumental science. That's my background, analytical geochemist. But I have truly embraced this concept of bringing on community partners who become a genuine part of developing the proposal. So this kind of gets to what Catherine said, that sometimes it's challenging to get these things through review and that's because we are the gatekeepers in that sense. I mean, we collectively, maybe not us on this call, but the scientists are their own worst enemy with these things. But I have been moderately successful with NSF by building in, and here's the problem when you think of like the community engagement just as a broader impact, because then that's like, I'm going to do this research, and then I'll maybe talk to a community member and do something. Instead, I found, and I've got this, I have 2 NSF grants right now that include this, is that the community partner is it's not a co-PI because they're not at the university, but they are a senior researcher. And so they're built in, and both of them, they're built into the that research engine. Jesse showed that great network. It's sort of built into there. And what I found is if a proposal isn't like, oh, the sociologists are going to do this, the earth scientists are going to do this, and the health people are going to do that. If you instead make it a little bit more convincing that this problem is so difficult that's why geochemists alone haven't been able to solve it. That's why we get valuable insight from our community partners and actually even framing the research questions. And one example I brought into one of my proposals is that I funded on a pilot, I funded a set of youth scholar program in one of our community-based organizations. This is to fight lead poisoning, right? I trained them in the lab. They went out and did all the actual work, and they brought their innovations back to the lab. They actually completely transformed the way I approach some of my community-based research, not just theoretically, but actually. They gave me 3 new tools that I implement now that I never would have thought of sitting in my ivory tower, or even being someone who on my campus is known as a community engaged researcher, because I sought that perspective. So I always throw in some stories like that and say, this is why this kind of engagement, genuine engagement, is so critical from the get-go. So again, I don't want to discourage anyone by my previous thing of, oh, you're not going to get tenure on it. Some universities, my own is using community-based research as now one of its new tenure criteria. We'll see how that floats when it's rubber hits the road. But I think it's more optimistic than that. But I think Catherine mentioned this. A lot of us are paying, a lot of funding agencies are paying lip service to interdisciplinary research, genuine community engagement, until it comes down to the reviews. And then you get hammered for that kind of stuff. So sorry, a bit of a mixed bag, Tate, but I think there is some optimism there.
It sounds like the importance of integration between the two is how you would kind of demonstrate the importance of it and how you would be able to I guess satisfy both sides. So I appreciate your input on that. Thank you.
And 2 different models I've seen work really well. One is to not on the same grant, but to build partnerships with your colleagues on campus or at other universities who are addressing the same issue but have their own funding streams, so that you're attacking the same problem just from different ways. And so it's not like you're both trying to put a oval into a square peg or a circle peg. Is that, you know, faculty that can get what they need for their tenure, because the social science folks, you know, they do this stuff all the time. They have their own funding streams, their own tenure qualifications. It's just maybe finding a way to have those conversations at a higher level to say, how can we both work on this same problem? And then I've said it a little bit, but maybe to make it more explicit, we have in most states, I can only mostly speak to our state here, but in our extension service, we have folks that are focused on community health. It's mostly from the nutrition perspective, but we have people funded to work with like the WIC program, you know, women, infant, and children. You know, so we have people embedded in after school programs, and they're always very keenly interested in how they stay up to date. What is the latest research? Is there new materials? And so those people are already out there. So I might put also a plug in for you know, broadening your network, and just making sure your research gets in the hands of those who can use it.
I think that's a great plan, and working maybe with another graduate student who's interested in the community side of the problem, and then working towards your funding streams independently might be very good. And I don't want to say that the NSF or the NIH doesn't fund social science research, because they do fund, and they fund one of the grants that I co-lead a portion of, which is Southwest Health Equity Research Collaborative. And that has a broad social science component to it. And they are trying to integrate both the social science and the bench science. And they're really pushing us to do that for the renewal. So I think the granting agencies are getting the message, and maybe we just need to do a little more work in that area. But for the grad students, I think finding good collaborators so that you can dovetail together might be a way to go at this stage of your career.
And I think Tate, that's one thing that's really changed. Certainly, Kathy and I have a shared academic background. And certainly when we were either in your position or maybe a little later on in our career development, kind of toward the end of our graduate work, starting postdocs, things like that, it was dissuaded. We were dissuaded from doing collaborative research. And I think that's one area that's really changed today relative to 3 years ago when Kathy and I graduated. So that was an obvious joke, but no, that's something that I think is a generational change that's really happened in scientific academia. Well, what do you think, Kathy? I think people are tired. I think we've had a great 3 days. I think maybe people need to digest and think about some of the information that we've disseminated over the last few days. And as Gabe wrote in the chat, if there is interest in being involved in a large multi-author editorial, that is something that you may want to get in touch with one of the co-organizers of this of this workshop, which would be either myself, Jesse, Kathy, or Shannon Bartelt Hunt. So by all means, reach out to us and let's put something together.
And we will be communicating with you all for this option. So would you hear from us, please feel free to be willing to collaborate on a broader scale.
And I am not, I just want to be, put it out there for into the public domain. I am not in witness protection. It's just I'm being backlit because it's very sunny here in Moscow, Idaho. So I apologize. I'm not trying to hide my identity here. I'm just in a small office with limited mobility, and it's very bright right now. So.
Jesse, do you have anything? Yeah, do you have something to add, Jesse?
Sure. Alan, you need a voice modifier as well. So that it really does the whole gamut. No, I agree. And Gabe, I thought you just did a wonderful job of summarizing a lot of my feelings around this as well. Communication, building equity, health, education, or the education equity, all these different issues into graduate education is, I think, greatly important. But then also, yeah, putting pressure on funding agencies. And, you know, I get funding from NASA and NOAA, and we do definitely have engagement within the projects that we have there. But sometimes when you look at some of these grant applications, they can also be kind of like, yeah, you know, we're just throwing this on because this is going to sound cool. But thinking about it from a very thoughtful perspective, how we actually can do this in a legitimate way, and that it's not just a throw on in some capacity, I think that means a lot. And Gabe, you obviously have been doing that with some of the projects that you've been involved with, and that's wonderful to hear. And so Tate, when you move forward, I think that's obviously an area of interest for you. And so I think that's an opportunity to learn from. So, but yeah, I think this has been a wonderful event. I've really enjoyed the conversations around this. And yeah, communication, it seems to be like the driving factor.
Well, I'm going to throw it to Gabe for the last word after I say thank you to him, especially for being the plenary speaker and coming in and helping us lead this. And I want to just do one last throw out to the CHER group, Amy and Marcel and Julie and Bob for coming up with the funding to do this and helping. That they've been behind the scenes, but they dramatically helped us organize how we moved forward with all of this. Without these guys, this would not have happened.
Great job, team. The IT in this was spectacular. Thanks so much for that.
My only last word is great job. And I look forward to continuing to engage with this group. I think you built a nice little kernel, a pod of, I wouldn't say just like-minded people, but a very powerful group of people. And I look forward to engaging with you all further.
All right. Time for lunch on our side of the world here. Talk to you all later.